This video is for general information only and does not replace advice from your own GP, pharmacist, or diabetes team. Always follow your prescribed regimen and speak to a healthcare professional before making any changes to your medicines. Which GLP-1 medicine is least likely to cause nausea? It's one of the most common questions people ask when starting this type of medicine, and it's a really important one. Nausea affects a lot of people on GLP-1 therapy, and understanding why it happens can make a real difference to how you manage it. GLP-1 receptor agonists are medicines used to help manage type 2 diabetes and, in some cases, weight management. They work by mimicking a hormone your body naturally produces, one that stimulates insulin, reduces another hormone called glucagon, and slows down how quickly food leaves your stomach. That slowing effect, called delayed gastric emptying, is part of how these medicines help control blood sugar. But it's also the main reason nausea happens. When food sits in your stomach longer than usual, it can cause that uncomfortable feeling of fullness, bloating, and nausea. It tends to be worst in the first few weeks of treatment or after a dose increase, and for many people, it does ease off over time as the body adjusts. Now, not all GLP-1 medicines carry the same nausea risk. Research suggests that dulaglutide and extended-release formulations generally show lower rates of nausea compared to twice-daily exenatide or higher-dose versions of semaglutide and liraglutide. One reason once-weekly formulations may be better tolerated is that they tend to produce more stable levels of the medicine in your bloodstream with lower peak concentrations, and those sharp peaks are thought to be part of what drives gastrointestinal side effects. That said, individual responses vary considerably. What one person tolerates well, another might find difficult, so it's never a straightforward comparison. If you're experiencing nausea or you're about to start a GLP-1 medicine, there are some practical things worth discussing with your GP or pharmacist. Gradual dose titration, starting low and increasing slowly, is one of the most effective ways to improve tolerability, and most prescribing regimens are already designed with this in mind. Never start, stop, or change how you take a prescription medicine without guidance from your prescribing clinician or pharmacist. Dietary changes can also help. Eating smaller, more frequent meals, avoiding high-fat or rich foods, and staying well hydrated are all strategies that research suggests can reduce nausea during GLP-1 therapy. If you have any existing gastrointestinal conditions, particularly something like gastroparesis, make sure your GP is aware before starting this type of medicine, as these medicines need to be used with caution in those cases. On the subject of safety, most nausea with GLP-1 therapy is mild to moderate and settles with time, but some symptoms need urgent attention. If you experience severe abdominal pain, persistent vomiting, signs of dehydration, or yellowing of the skin or eyes, please seek urgent medical help via NHS 111, your local urgent care service, or call 999 in an emergency. These can occasionally indicate more serious conditions such as pancreatitis or gallbladder disease. So to recap, nausea is a common side effect of GLP-1 medicines because they slow gastric emptying, but the degree varies between different preparations. Research suggests dulaglutide and once-weekly formulations may be better tolerated by some people, though individual responses differ, and practical steps like slow-dose titration, smaller meals, and avoiding fatty foods can significantly improve how you feel on these medicines. If you're weighing up your options or struggling with side effects, please do speak to your GP or pharmacist. They can help find the right approach for you personally. Have you had experience with a GLP-1 medicine? Feel free to drop a comment below, though please don't share any personal or identifying health information. And if you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more straightforward health information.